Welcome to Yaka Digital Network. When we think of medical treatment at rural health centers like Windy Community Hospital, we usually picture pills and injections. But some of the most powerful medicine available is actually found outside the pharmacy. Looking at the abundance of local produce traded in Ugandan markets, we are actually looking at a vital toolkit for nutritional recovery. This is the core of dietary therapy, the practice of using specific food choices and meal plans to treat a medical condition. When a nutritional disease occurs because the body lacks the right balance of nutrients, we fix that balance directly through the diet. To be effective, dietary therapy relies on a foundation of 3 specific pillars. First, nutrient density. Second, digestibility. And third, food safety. Applying these pillars means going beyond basic advice about eating a balanced diet. It requires us to actively adapt those necessary nutrients to accommodate the physical limitations of a sick or recovering body. We see these physical limitations clearly in cases of protein-energy malnutrition, or PEM. This condition stems from critical shortages in macronutrients, and it manifests in 2 distinct physical ways. This compares the 2 forms. Kwashiorkor, on the left, is caused by severe protein lack. Notice the swollen limbs, puffy face, and skin lesions. Marasmus, on the right, results from an overall energy deficit, leading to extreme fat loss, visible ribs, and severe wasting. These patients often have very poor appetites, creating a clinical challenge. Look at these options. Bowl A is plain maize porridge. Bowl B adds groundnut paste and mashed fruit. Pause the video. Which bowl is better dietary therapy for a suppressed appetite, and why? The therapeutic choice is bowl B. Adding groundnut paste introduces high-quality proteins and fats. This is the first pillar of dietary therapy in action: nutrient density. Since a PEM patient can only eat small bites, we must pack maximum recovery calories and proteins into the smallest physical volume of food. Recovery also depends on whether the body can actually absorb the nutrients we provide. Consider anemia, a condition where the body lacks healthy red blood cells due to iron deficiency. Watch this plant-based non-heme iron from local beans enter the digestive system. On its own, it struggles to pass the stomach lining. But introduce biological synergy. Vitamin C from citrus binds to the iron particles, carrying them smoothly into the bloodstream. This precise coordination can be easily disrupted by metabolic stressors like alcohol and drugs. A common misconception is that because alcohol contains calories, it provides useful energy. In reality, it provides empty calories and acts as a physical barrier. Chronic alcohol use irritates the intestinal lining, physically preventing the body from absorbing vital B vitamins, even if the person eats a balanced diet. Effective dietary therapy therefore requires 2 simultaneous actions: carefully pairing synergistic foods, while strictly eliminating the metabolic stressors that strip the body of its ability to heal. Let's map out how these therapeutic strategies apply to common nutritional conditions. For protein-energy malnutrition, we prioritize high-protein, energy-dense meals like enriched porridge. For anemia, we ensure iron-rich foods are paired with vitamin C to guarantee absorption. During alcohol recovery, the focus is on replacing lost vitamins with gentle, highly digestible foods that don't stress the liver. And for conditions that compromise the immune system, like HIV/AIDS, we enforce the 3rd pillar, strict food safety, ensuring all meals are pathogen-free and prepared with treated water. By managing nutrient density, digestibility, and biological synergy, we leverage the specific chemistry of what we eat to reclaim strength and treat disease. For more resources, detailed study guides, and full course modules, visit Yaka Digital Network. Head to www.yaka.cc to access your content.